And if beauty is terror, said Julian, then what is desire? We think we have many desires, but in fact we have only one.
Hello everyone. When we think about a movement, we usually think about our skeleton, right? But did you know that our bones can move on their own? That's where joints come in. So today we're going to talk about the joints of the skeletal system and how they help us move. Joints, also called articulations. Joints are the places where two or more bones meet. They help hold the skeleton together and allow our body to move. Imagine a door hinge. A door can't open or close without its hinges. In the same way, our body wouldn't be able to bend, walk, or run without joints. Joints do much more than connect bones. They hold the bones together, allow bones to grow, and even help the body change shape during childbirth. Most importantly, joints work together with our skeletal muscle to make movement possible. Imagine building a robot. Even if it has strong metal parts, it still won't move unless the parts are connected with movable joints. Our body works the same way. Inside some of our bones is a soft tissue called bone marrow. This is where hematopoiesis or blood cell production takes place. There are two types of bone marrow. Red bone marrow produces blood cells, while yellow bone marrow mainly stores fat as an energy reserve. Think of bone marrow like a factory. One section is busy making blood cells every day, while another section works like a storage warehouse, keeping fat for future use. Let's look at two types of bone marrow. Red bone marrow produces red blood cells, right? White blood cells and platelets. It is commonly found in the skull, ribs, sternum, vertebrae, pelvis, femur, and humerus. On the other hand, yellow bone marrow mainly stores fat. During severe blood loss, it can change back into red bone marrow to help produce more blood cells. It's kind of like a company. One department is always producing workers, while another works as a storage room. During an emergency, the storage room can be turned into another production area. As we grow older, our bone marrow also changes. Babies and children have mostly red bone marrow because their bodies need to produce many new blood cells while they're growing. As we become teenagers and adults, much of that red bone marrow changes into yellow bone marrow, which stores fat. However, during severe blood loss, yellow marrow can become red marrow again to help the body produce more blood cells. Here's a simple comparison. In a classroom, when there are many students, every classroom is used for learning. But if there are fewer students, some classrooms become storage rooms. If more students arrive again, those storage rooms can quickly become classrooms once more. Joints are grouped into three structural types based on what connects the bones and how much they can move. These are fibrous joints, cartilaginous joints, and synovial joints. Some joints don't move at all. Some move only a little, and some can move freely. Think of it like three different kinds of door. One door is locked and can't move, another opens a little, and the last one swings open freely. Let's begin with fibrous joints. In fibrous joints, the bones are connected by dense connective tissue. They do not have a joint cavity, and the bones stay very close together. Because of this, most fibrous joints cannot move, making the synarthrotic joints. There are three types of fibrous joints: syndesmosis, suture, and kyphosis. Think of fibrous joints like strong ropes tying two objects together. The connection is firm, so there's little to no movement. Now, let's look at the three types of fibrous joints. First is syndesmosis, where bones are connected by ligaments or a sheet of connective tissue. A good example is the connection between the tibia and fibula. Next is the suture, which is found between the bones of the skull. These joints are immovable, helping protect the brain. In babies, the suture are still open to allow the skull to grow, but in adults, they become tightly joined. Lastly is kyphosis, where a tooth fits securely into its socket in the jaw. Think of this like everyday objects. Syndesmosis is like a strong rope tying two poles together. A suture is like puzzle pieces that fit tightly. And gumbosis is like a pencil placed snugly inside a pencil holder. The second structural type is cartilaginous joint. Here, the bones are connected by cartilage instead of dense connective tissue. These joints may be immovable or slightly movable depending on the type. There are two types, synchondrosis and symphysis. Think of cartilage like a soft cushion placed between two hard objects. It holds them together while giving a little flexibility. Let's look at the two types of cartilaginous joints. The first is synchondrosis, where bones are connected by hyaline cartilage. A temporary example is the epiphyseal plate, also called the growth plate, which helps bones grow longer during childhood. A permanent example is the joint between the first rib and the manubrium. The second type is symphysis, where bones are connected by fibrocartilage. Examples include the pubic symphysis and the intervertebral discs, or IVDs, between the vertebrae. Think of a car's shock absorbers. They cushion the impact when driving over bumps. In the same way, fibrocartilage helps absorb pressure and protects the bones. Now, let's move on to the third structural type, which is the synovial joint. Synovial joints are the most common joints in our body. They have a joint cavity filled with synovial fluid, making them freely movable or diarthrotic. Their main parts include the articular cartilage, joint capsule, synovial membrane, synovial fluid, meniscus, and bursa. Each part works together to protect the joint and make movement smooth. Think of a well-oiled door hinge. The oil helps the hinge move smoothly without getting stuck. Synovial fluid does the same job for our joints. Each part of a synovial joint has an important job. The articular cartilage covers the end of the bones and reduces friction. The synovial fluid acts like a lubricant so the bones can move smoothly. The joint capsule surrounds and protects the joint. The meniscus helps absorb shock, while the bursa reduces friction between nearby muscles, tendons, and bones. Let's compare it to a car. It has oil, rubber cushions, and protective cover that all work together to keep it running smoothly. Our joints work the same way. The knee joint is the largest and one of the most complex joints in the body. It is formed by the femur and the tibia, while the patella or kneecap is located at the front. Inside the knee are the menisci, which cushion the bones. The joint is also strengthened by ligaments, tendons, and bursae, helping keep it stable while moving. Think of the knee like a car suspension system. It has different parts working together to absorb shock and keep your ride smooth. Synovial joints come in 6 different types, and each one allows a different kind of movement. The pivot joint lets the head rotate, like the joint between the atlas and axis. The hinge joint bends and strengthens, just like the elbow. The saddle joint allows the thumb to move in different directions. The condylar or ellipsoid joint is found in the wrists and knuckles. The ball and socket joint, found in the shoulder and hip, allows the greatest range of movement. Lastly, the gliding joint lets bones slide over one another, such as in the wrist, ankle, and vertebrae. Image these joints like different tools. Each tool has a different job, and each joint is designed for a specific type of movement. Let's take a closer look at the atlas and axis. The atlas, or C1, and the axis, or C2, work together to form a pivot joint. This special joint allows you to turn your head from side to side, such as when you're saying no. Think of it like a swivel chair. The chair rotates smoothly, just like your head rotates, because of the atlas and axis. As we age, our joints naturally change. One of the first signs of aging is joint stiffness. Fibrous joints are usually the first to become stiff. The vertebral discs, or IVDs, slowly lose water over time. Because of this, they become less flexible, and some people may even lose a little height. The good news is that regular exercise helps keep the joints healthy by improving blood flow and maintaining flexibility. Think of a rubber band. When it's new, it's soft and stretchy. But if it's left unused for a long time, it becomes stiff and less flexible. Our joints are similar, they stay healthier when we keep moving. Sometimes joints can develop disorders that make movement difficult. One example is gout, which happens when uric acid crystals build up inside a joint. This causes pain, swelling, and tenderness. Another common disorder is arthritis, which is the inflammation of a joint. It can cause pain, stiffness, and reduce a person's ability to move comfortably. Think about again a door hinge. If dirt builds up inside it, the hinge becomes harder to move. Our joints can also become stiff and painful when affected by these conditions. Joints allow many different kinds of movement. Flexion bends a joint, while extension strengthens it. Hyperextension is extending a joint beyond its normal range. Abduction moves a body part away from the midline, while adduction brings it back toward the midline. Lateral flexion bends the neck or trunk to the side. Rotation turns a bone around its own axis, while circumduction creates a circular movement. Lastly, dorsiflexion lifts the toes upward, while plantar flexion points the toes downward. Think about doing a warm-up before exercising. Every stretch you do uses one or more of these joints movement. Let's quickly review what we've learned. Joints, also called articulations, connect bones and make movement possible. We learned the three structural types of joints: fibrous, cartilaginous, synovial joints. Among them, synovial joints are the most movable and are found in many parts of the body, such as the shoulders, hips, elbows, and knees. We also discussed the knee joint, the different types of synovial joints, common joint disorder, and the different movements our joints can perform. Remember, keeping our joints healthy through regular movement and exercise helps us stay active throughout life. Think of your skeleton as a machine. The bones are the frame, but the joints are the moving parts that allow everything to work together smoothly. And that's it. Thank you so much for spending your time learning with me. If you found this helpful, don't forget to like, subscribe, and turn on notification bell so you won't miss future medical or science videos. Until next time, study smart, and I'll see you in the next one.